Yay! Ready?
Ready.
Okay. Here's the disclaimer playing now. The calls and comments and has a little bit of management. That's right, isn't it?
Well, it works out.
It's time for Stages of Life Radio with Dr. David Klein. Have a medical question? Call 407-422-1212. That's 407-422-1212. Or text 23680.
Welcome, everybody. Well, cue the cool music.
Love that cool music.
I do, too. It's a picker's hop. They figure and they groove. That's what they do. And we are Stages of Life Radio. We talk to you, take your medical questions, and
give you medical answers.
Give you medical answers. Yeah, there it is.
Yeah.
Sorry, I brain farted. It was like, anyway, yeah. My mind's on the Buccaneers and the Green Bay Packers. Feel free to hit me up with the score, folks, at 23680. That's our text line. 407-422-1212. That's our phone number. People are already on the line, bud. So what are we going to do?
Well, first thing we're going to do is we're going to talk about the issues at hand.
Okay.
So what I like to do is take the first 5 or 6, 7 minutes of the show, sometimes a little bit longer, sometimes a little bit less, and try to make a difference, make a dent in people's lives, to do what I can to help. And the little bit of advice I'm going to give you is philosophical. And the philosophy goes something like this. It's best to prevent than it is to treat medical illnesses. Sadly, this is a lesson that we all learn our entire life until we make the very last decision, the very last mistake, and then we pay the price for it.
The ultimate price?
The ultimate price. My dad did this. Okay, when you prevent illness, preventive medicine, it's a whole lot more cost effective. It's a whole lot less painful, but it's a bigger pain in the butt. So what do I mean by that? What I mean by that is very simple. You have to work. There's nothing out there in life, zero, nada, nothing, that isn't going to, that's going to come to you without effort. Certainly nothing of any value. There are a lot of things that have little value or no value that you can just hang around and they'll fall on you. But when it comes to things like health, when it comes to things like wealth, when it comes to wisdom, education, nothing comes without effort. And the harder you work at it, the more you work at it, the more persistent you are, and to some extent, the more patient you are, the better you will do. So, you talk to these financial guys. Okay, so there are lots and lots of financial shows. And I do, in fact, listen to them, maybe 2 or 3 minutes at a time. And the lesson's always the same. Well, you have to pay less taxes. Well, that's great. Okay, that's marvelous advice if you're earning a lot of money. But it's really lousy advice if you're trying to figure out how to make it, which is the lion's share of the listeners. Most of the people listening in could really use advice like, gee, how do I get some?
Right.
That would be more useful advice, but it's a longer-term lesson. More so as it's hard to monetize it. Okay. What are you going to do? Teach somebody else how to go on? Well, you need to go to night school to learn X, Y, and Z. Really hard to pay your own bills by giving away that type of advice. What I'm going to do right here, okay, is going to do just that. It's going to help you, hopefully, philosophically, to understand what you need to do to reap dividends down the line. And it doesn't involve spending a lot of money, but it does involve some work, a little bit of study, a little persistence, and a lot of patience. And it's preventive medicine. So when you procrastinate and you push things off, and I'll get around to this and I'll get around to that, the damage that you're doing to yourself by waiting just continues to increase arithmetically, a little bit each year, a little bit more damage. Smoking. Well, I'll stop next year. I'll stop in June. I'll stop at my birthday. Every cigarette you light up shortens your life. Every candy bar that you eat increases your chance of developing diabetes. Every antibiotic you take increases your risk of diabetes. Every night you stay out too late, and the list keeps going and going and going. Every can of beer you exceed or you drink in excess of what your body can metabolize is going to cause incremental damage. So you need to make a decision, big decision. And that is, what am I going to do to improve my physical condition? What might I be able to do to improve my emotional condition? Because it does make a difference there also. And then you can take care of your home life. You can listen to a lot of people that'll talk about, well, how do you give back to the community? And that's something else that's very, very important. It's hard to give back to the community when you can't take care of yourself and your own family. And that's a fact. You can do it. Okay, it just takes a little bit extra effort. Those people are even better at allocation of their time. So we're getting through this episode in our lives, something that we're going to forget about next year, and it's called the COVID pandemic.
I hope so.
Yeah, we're going to all forget about it. As soon as the economy opens up, it is going to be passé. People don't even think about when Prince died. Oh my God, the day music died. No, we found other people to take his place. Most people in this country, in this world, when you pass away, you get mourned for a brief period of time, and then the net effect on the world is as if you had taken your hand, put it in a bucket of water, and taken it out. The bucket of water doesn't care. But there are things that you can do that will make incremental differences in your life, and if you're a parent, a teacher, or a doctor, it's going to make incremental improvement in others. So what do you not want to do? And it's to put off that which makes sense today. So I started, when I was 14 years old, I started an IRA. 14, I'm now 66, just about. Okay, you know that little bit of money that I put in that account when I was 14 years old and every year thereafter is my retirement right now. Not Social Security. Now that's nothing compared to what that IRA turned into. And yet, I may have been the only person in my group, my cadre, my clique, my rock and roll band, these groups of people that I would hang with that thought that it was a good idea. So incremental change, incremental contribution pays off monetarily, but it also pays off in terms of health. I was the only one that didn't smoke. Now, many of them have stopped smoking, but if you look at these people, they do not look as I do. Their skin is not the same as mine. Their teeth are not the same. Men with osteoporosis, all kinds of crazy stuff. And these are people that I hung with. The main difference was not paying attention to the things early on and not paying attention to them as they were called to your attention. So we're going to talk about the different sorts of things that you need to do, why you need to do them, what you need to give up to do this. What does it cost? Nothing comes for free. Well, my insurance doesn't pay for it.
Come on now.
You know something? Nobody cares about that. Your insurance doesn't pay for your cigarettes either. Whoops. It doesn't pay for your beer. Okay, it doesn't pay for a lot. Doesn't pay for movie tickets or concert tickets. Right. Your insurance doesn't pay for this. You have to. Okay, that's the way that it goes. If you want good dental health, you'll have good general health. That doesn't typically come without a ticket attached to it.
Sure.
So you have to make an adult decision. You have to become the adult. And many people live their entire life and never become the adult. Well, somebody will take care of me in my old age. Not a chance.
Nope, not gonna happen.
No, I don't think so. Talk to Governor Cuomo about what it's like to take care of people in nursing homes, right?
Stop.
Yeah, look at that. Isn't that something?
You want to get this phone call before we go to break? Okay.
Let's take a phone call.
Susan, are you there?
Let's see.
Susan.
Earth to Susan.
Okay.
Well, we'll come back to her when she's...
I heard her. Wait.
Oh, you got her?
Susan, are you paying attention?
Yes, I'm here.
Oh, she's here, but she's not... Well, I can hear her someplace on that monitor.
That's okay. We'll deal with it. Anyway, I know what her question is.
All right. You know what her question... Well, in any event. Okay. What was her question?
Susan's question, she's from the village. She has a friend who is 70 years old and has chronic hives.
That's interesting.
That is interesting.
Okay. Yeah, it's called angioneurotic edema. So there's a word for hives. And so what happens is it's a histamine degranulation that can occur as a result of emotional instability, let's say. Not that your friend is unstable, but excitable. So if I get excited, I break out in hives. It's actually kind of cool to watch because it's one of these sorts of reasons why these people don't do well at poker, okay? Because you end up with a good hand and you end up breaking out into hives. But if the question is this, well, my friend has hives, what can I do about it? And the answer is this. They are very, very used to taking regular phenothiazine type antihistamines, and they don't work real well for this. They may give her a little bit of relief, or I guess it's a she. Most of the people living in the villages are actually female, as it turns out. Why? Because there's so many dead men out there.
Stop it.
Well, it's true.
Stop it.
We'll get to the answer to your question after these important announcements, which are very, very important. So I encourage you to listen closely.
Please support our sponsors. Pharmacy specialist, Dr. Juan Loca. He's just awesome.
He's a good dude.
Great compounding factory, the stages of life. Works with all the time, forever and ever. Check them out.
Well, 40 years.
At makerx.com. All right?
Don't tell them we said to call.
No, do that. This is Stages of Life Radio. We'll be right back. Give us a holler. Our phone line is 407-422-1212. You're listening to Stages of Life Radio on News Radio WFLA Orlando. This is a very short break.
Okay.
All right. I know Lee had a question last week online about something, but I don't remember what it was. And I don't know what I know he's there, but I don't know.
Well, maybe he can do it again. Just send it to us. Text it back to us.
Something to do or something or other.
Yeah,
Skin and men.
But I really want to wait until we come back to handle that text about the atrial fibrillation
Yeah, we
and
need to
sleep
do that.
apnea, because there's going to be a lot of people that are going to be interested in that. You know, so if we had to, we could probably take the one text we got right there and get it done in 60 seconds or less. How much time do we have?
What, now? A minute and a half.
Okay, good. Okay, so patient has had chronic back pain for 15 years. MRI shows degenerative disc disease, which, by the way, they all do. He uses an inversion table to decompress the spine. Good idea. Why? Because it only costs a couple $100, if that, and it does work, and you don't have to pay the chiropractor. Any health risks hanging upside down? And the answer is yes. You never hang upside down. That's for that crazy guy that's on television with the inversion table there. He hangs by his feet like a bat. You do not have valves in the veins that go from the heart to your brain. And when you're upside down, it increases the venous back pressure to the brain. It'll cause edema of the brain. It'll cause bleeding behind the eyes. So the proper way to use an inversion table, which I own one and use it,
Really?
is 15 degrees.
I'm coming
You
over.
go head down. You're welcome to use it. 15 degrees head down for 15 minutes. Now, the best thing about the inversion tables is that you can tie them in such a way as that it won't go any further than that.
30 seconds.
You hang upside down, you're running risk.
I know. Wiggy. Wow. Hi, welcome back to Stages of Life Radio. I am Melissa Fox. I don't even think I told the people that. I'm just assuming you all know.
Well, they all know.
They do not.
They do know. Yeah. They've been listening to you for years. Howard Stern even remembers your name.
I know he does, actually. Hey, okay. So we've got another call here, and we've got the text line with some questions on it as well.
Let's grab the call after I take that
Okay, text line is 23680. That's wide open for you. Okay, go on. Just read
So the first text of the day is a good one. I wanted to hold this until we got a few more people on board listening to us. And it goes a little something like this. Do decades of sleep apnea cause atrial fibrillation and subsequent pacemaker? And the answer is it can. Sleep apnea, which is something that actually the majority of adults will have if put in a sleep lab situation. Essentially, in all the years I've had people do this, I've never seen somebody come out of a sleep study that wasn't told they had sleep apnea. So they have a very low threshold to tell people, well, you stopped breathing 88 times for at least, well, that may actually not necessarily be that big a problem. But there are degrees of sleep apnea. And when you end up with the more severe cases, it'll cause hypertension, pulmonary hypertension, and subsequent damage to the heart. And when that happens, atrial fibrillation is the most likely outcome, and then the most likely way to fix it if you're not into endocardial ablation, okay, which is what they love to do because they can charge more, you put a pacemaker in. So the typical thing that I tell people to do, well, I have sleep apnea. How do you know? Well, because they're all told that they have it. The better person to ask is the spouse. Do they just start to snort and carry on and then stop, make awful noises, and then breathe after you elbow them? And if the answer is yes, then you've got a pretty good case for something being a problem. Now, the first thing you do is lose weight. If you can lose weight, most of the people with this get better.
Okay.
Do skinny people also get sleep apnea?
Yes.
And the answer is yes, but it's usually people that have these double chins, just barrel chests, and years of extra hamburgers. So what you do is lose weight, and it usually gets better. The atrial fibrillation can sometimes be aborted or prevented by using coenzyme Q10. The dosage is 300 milligrams a day. That's something that if you think this may be a problem, that would be something well worth doing. But that's a great question.
Let's get to Kathy now.
Yes.
By the way, again, text line 23680. Hey, Kathy from Orlando, how are you? Is she there yet?
Oh, we're having some technical issues.
It was there a minute ago. Hey, Kathy.
Hi.
Right now I feel better about it.
Okay. What's your problem, darling?
Well, my question is that can wearing a mask affect your sensitivity, your eyes' sensitivity to sunlight?
No.
Would there be any correlation? And if not, what might be something that would start causing your eyes to be more sensitive to sunlight?
Okay, what'll often happen is you'll end up getting dust, you'll end up getting dander, you'll get all kinds of things in the eye causing a type of contact dermatitis or conjunctivitis. The masks are kind of interesting. Okay, now, and I enjoy going after people that give me the hard way to go about masks. They go, "Why aren't you wearing your mask properly?" And the answer is because I have asthma and I have to wear hearing aids and I wear eyeglasses. So it turns off my hearing. I can't see with a mask and I go completely ballistic because when I'm put in a box and I can't see or hear, I get a little bit cranky.
It's fun to watch, though.
It's fun to watch, but it's not a lot of fun because I have to work that way. But the problem is most people don't wash their masks.
Yeah.
All right. And so then it ends up building up all kinds of garbage. This will cause the contact dermatitis. So how long do you think that cloth mask will last before it becomes soiled? And I'll answer it for you. And the answer is 1 hour. How often should you be washing it? And the answer is you need to change them at least twice a day and then put them in the washing machine. People say, "Oh, I don't want to do that. It's too much trouble." And I'll say, well, the only other garment that you're wearing right now that's filthier than that mask is your underwear. So I tell these people, I said, what you need to do is to consider taking off your underwear, pull it over your head around backwards, and it's probably cleaner than your mask. And I'm probably correct. So that's more than likely what's going on. So if you get yourself just some, a tap water, okay, you don't need to spend money on this. And you put your hand under the tap water, get your fingers nice and moist, close your eyes, tap your eyes. Enough water will wick in underneath your eyes to wash this stuff out. And you just do this periodically and you'll do just fine. If you want to spend a lot of money, you can go buy the Visine. You can do all kinds of stuff.
Stay away from the natural tears and stuff because
it's garbage.
It's not good.
It's just not. Yeah, it's not healthy. Go on.
Dr. Klein, how about boric acid?
Okay, boric acid is called an astringent. Okay, I use a lot of boric acid in my practice to treat styes. So you end up with little tiny abscess. It's a pimple of the eyelid. And they hurt like crazy. Okay, they'll get in your way. They're distracting. They're annoying. And most people, not most people, but a large number of people will experience these once or twice in their life. There's a little gland that becomes obstructed and then it gets infected and it's uncomfortable. And you can use boric acid to draw out the pus, the abscess. The way that's done is to get like one of those Pyrex cups, the kind that you have in your kitchen. You can use one right out of your kitchen as long as it's clean. And you fill it with about a pint of water, hot water. Nice hot water, which you can either get out of your Insta heat thing or you can, heat it up in the microwave. And you put a half a teaspoon of boric acid in that pint of water. Mix it up, let it dissolve. It takes a minute or two. And then you take a washcloth, dip it in there, make sure it's not too hot, and hold it over the eye for about 5, 6, 7 minutes. You wring it out, dip it back in, make sure it's still warm or hot, put it in your eye, and it will draw out the infection. So boric acid is marvelous for infection. But when it comes to inflammation, it's pretty useless. Wouldn't be bothering with it. If you have allergic conjunctivitis, though, there's something called quercetin, which is an oral tablet that may be of some benefit to you. Dosage is 500 milligrams twice a day. So, Kathy, I know just what you got because I've been bothered with it too. Mm-hmm. Bear with it. We're not going to be wearing these masks more than another few months.
Okay, Kathy's line's open at 407-422-1212. We got a lot of questions on our social media. People are watching us at Stages of Life Medical Institute. They're also watching us on our WFLA Orlando page.
Cool. What about our anti-social media on Parler?
Oh,
anybody?
Yeah. No, Parler's not back on there. I think they're moving to other things. I'm trying to catch up. I'll let you know in the week. Let's see. My fiance is developing a cold sore. Curious if black licorice root drops around the area will help. It's an antiviral.
No, it's not black licorice. Okay, yeah. It's just licorice root.
Yeah.
Black licorice is a candy. Okay, anise is actually what the licorice is, and so what you do with licorice or glyceric acid, which is the licorice root drops, it's an oral antiviral. Doesn't do very much for cold sore. There are many of these little things out there that might help. Generally, when somebody comes in and they've got themselves one of these nasties on their lips, and I'm going on a date and I've got I have this or I have that going on, I'll start them on some acyclovir, and that generally takes care of it. And you can use topical acyclovir. It's a prescription that goes to work very, very quickly. Abreva is one that you can get over the counter that might help.
And I'm going to tell you my rule on this, as well as the little sores you get in the crack of the corner of your lip.
That could also be something called Perlesh, which is a B deficiency.
More times just the regular crack where you're irritated or you get dry lips, because I'm from up north, camphor or
petrolatum.
Yeah. Camphor is the name. I mean, you smelled it when you were at camp all the time. It's just something, and it actually does work to heal up the sting.
It's good stuff.
Take it. It's very good.
Yeah,
you can find it at CarMax. It's called CarMax. You'll find it at the checkout aisle. And a little yellow and red.
Yeah, right next to the starter fluid.
No, right next to the Reese's Cups. All right, let's see what else we got. All right, she said they tried those. Was curious, as Doc mentioned, black licorice. No, just licorice root.
Yes, it's licorice root extract.
There you go.
And it's simple stuff, but I like the liquid because it's less expensive. You can keep a bottle of that licorice root extract.
Can you read
liquid?
This?
It's hard to, but I think I've got it.
Luann.
I've lost 75 pounds. Some days my pulse is only low 60s, so I don't want to take my lisinopril anymore.
Drop it. Want to drop it? Should I half it, or should I take it all together? Or stop taking it all together?
The best way to deal with lisinopril, if in fact you want to come off of it, is you cut the dose in half. You wait a week, cut the dose again in half, and then drop it. But lisinopril doesn't cause a low pulse.
No.
It causes a low blood pressure. So if something is causing your pulse to be low, it's either you're athletic, you have atrial fibrillation, you got a problem there, or it could be something like a beta blocker. So I'd need more information really to go to work on that.
Yeah, she's at her goal weight. There's something else going on.
Yeah, I would think so.
Especially with the drop in the pulse like that.
There may be thyroid issue. You never really know, but there's more going on. I would not necessarily be changing the lisinopril without your doctor's approval, or at least is not understanding.
Got about a minute and a half. You want to take a call here?
Sure, let's go.
Sharon from Haines City. Hi, Sharon. She is 60 years old. Sharon, you've got leg cramps, muscle cramps?
Yes.
When do they usually happen?
Sometimes at night. Sometimes I, scoot along to change position, and then my leg will go into cramp, or my foot will go into a cramp.
Yeah, if you put
I can't straighten it.
Gotcha.
If you
put your foot in certain positions, the calf goes into spasm. Very, very common problem.
Really?
Usually occurs at night. And what I was taught when I was in school, and what you may have been taught when you were in school, was that this is a potassium depletion. So we're going to tell you to go eat bananas.
Eat a banana.
Which does fine, just makes you fatter.
Yeah.
What deficiency really helps this, though, actually, is magnesium. So you want to be taking a good chelated magnesium at bedtime. The dosage is between 200 and 600 milligrams of either magnesium glycinate, malate, taurate. And one of those three will do the job for you. So, but if it says magnesium oxide or carbonate, it is garbage. Just leave it on the shelf because you don't need to waste your money. That's the first thing. The second thing is you can frequently have a problem behind the knee called a tendonitis. So during the day, you're walking around, the foot gets dorsiflex and it's pushed upward and it stretches the muscles out and you do fine. But when you go to sleep, the foot has a tendency to drop down, the muscles go into spasm, and if you have a tendonitis behind the knee, use Voltaren topical gel behind the knee before you go to bed, and it usually prevents the muscle spasm.
Thanks, Sharon. Appreciate your call. Her line is open. We got to go to a break. 407-422-1212. Okay. All right. Yeah. And with regards to the lip thing, always try the natural remedies first, people. Yeah, that's common sense. You're a good one.
You would think.
Yeah. Well, you never know. Anyway, we'll take a quick break. Check the. Well, just stay right there. We're gonna check the news and all that happy stuff. It's Stage of Life Radio. There we go. Yeah. I don't know what I am saying today. All right. Your girl says she got cut off.
No, that's the young lady with the hives. So we'll go ahead and was she on Facebook or was she?
No, she's on the radio. So what I'm gonna do is I'm gonna do better math than that.
Better math.
There we go. Okay, well, I'm going to actually text her back. The chronic hives. And how could she not? Okay. Yeah, anyway, chronic hives. What to do real quick?
Okay, the answer is quercetin, Quercetin. Quercetin is an herb. Very, very cool stuff.
Okay.
Quercetin, the dose is 500 milligrams twice a day. And what that will do is it'll act as a membrane stabilizer to prevent mast cell degranulation. What that means, it prevents hives.
Okay, well, that's what it is. Okay, all right. Lee had a very complicated question here. Well, he got some new blood work. HDL 68,
All right.
TG 71, vitamin D 88, PSA 2.3, T 511, free T 98. BMI 25.1. He's 60 and doing carnivore.
So he's a little bit heavy, but otherwise he seems to be in pretty decent shape. And now I've got a dog in my lap. So a little distracting to have a bulldog kind of looking at you hungry as he's.
No.
Oh, yeah. So come on, puppy, let's go over here. Come on. Here we go. No, don't eat the cord. No, don't eat the cord. Gunther.
All right. 45 seconds.
All right.
Okay, so you said you're a little overweight. That's it.
Yeah, that's the main deal. It doesn't look like the blood work's all that bad. Triglycerides are good. So while you might be a carnivore, you might be doing pretty well with most things. The numbers don't look too bad. So if triglycerides are under 85, you are kicking.
Yeah,
Your vitamin D is perfect.
Last week he was trying to ask if you read The Carnivore Code by Paul Saladino, the doctor.
Which I didn't.
No,
Yeah.
He had not, but that's what he was saying. That's what he was
Oh,
asking.
you're doing fine. I'm a carnivore also.
Yeah,
Omnivore more
me too.
appropriately.
Hell yeah.
Either.
Does this multi-collagen protein stuff work? Getting a lot of hype lately.
Yeah, well, what they're doing is it's giving a lot of hype because they spend a lot of money on it, so they make a lot of money. What you're looking for is something called UC2 or type 2 collagen.
There you go.
Don't need to spend a lot of money for it, but the type 1 and type 3 don't do you very much good. But
All right,
type
Lee.
2 collagen.
Keep at it. Here we go. Welcome back to Stages of Life Radio, Sundays from 4 until 5 p.m. Lots going on. Lots going on today. We got a lot on the text line. Now, and I know. I did this whole article.
Yeah.
I did this whole article last week on Florida Roundtable, which you've been a part of
Yeah.
and will continue to be. And the problem lately is people aren't going to doctor's appointments or even making follow-up appointments or getting their meds checked because they're scared. And the safest places, I would think, would be a hospital or a doctor's office.
Well, not the hospital so much.
No,
I
but the
agree with
doctor's
that.
office,
Okay, we refer to the hospitals as pus pockets, actually.
No.
But yeah, the problem is that folks, don't believe all of the hype. Okay, wouldn't you know? Now things are starting to settle down after the inauguration. You ever wonder about that? So maybe much of what you heard wasn't as bad as it was or as miserable it was. So what we've got a virus. It is going to burn out. The funny thing about it is flattening the curve means we are going to have it longer.
Yes.
That is what flattening the curve
Sorry.
means. They'll say, but we're doing that to protect the hospitals.
No, we're not.
Really? No. It just prolongs the agony and gets the president out of office. Now we actually have somebody in there who's sane, if you believe that. And so what have we got? It was just a changing of the guard, and it was all done. So believe what you need to believe, but don't believe much of the nonsense. So yeah, I got over COVID. I got to tell you, it sucks. It's a terrible disease, but it was not as bad as many of the times I've had flu. So what do you do? Well, you either get the inoculation, which I did also.
Okay.
Okay. The day.
Don't even.
It was very, very bad timing. Okay, so I was actually coming down with the disorder when I got my inoculation. And they say, well, but that'll cause a terrible reaction. It doesn't.
It really doesn't.
It doesn't. That's nonsense.
No.
You know why they make you wait 2 weeks to go in? You think there's anything magical about that 2 weeks? Well, it's 2 weeks after the first symptom. You can then get the COVID vaccination because they just don't want you going in there and exposing
And
them.
being sick, yeah.
That's it. It's just to protect them, not because it really makes a great deal of difference.
Okay. All right. Fair enough. Now, I have, okay, wait, I got all these. I got a gal on the line here.
All these
Ann.
decisions.
Yeah, I know. All right, let's take it. Ann, hi, she's checking in. Ann, turn your radio down and listen to the phone. Ann is checking in from Cape Canaveral.
Cool.
She's listening to us on AM 540. She's 64, taking amlodipine. I can never say that.
Amlodipine.
You know it. For blood pressure. And she's got severe swelling in her feet.
That's typical.
Is that correct, Dan? That's what's going on?
Okay. So my favorite two antihypertensives, amlodipine and clonidine. Amlodipine is marvelous stuff because it's cheap, it's easy to take. You have very, very few side effects with it, except for one, and it's ankle edema. So what does that mean? It means your ankles swell. I took amlodipine for 2 years until I could get my weight down. My weight came down. My blood pressure went to normal. I took care of my thyroid. Thyroid goes up, blood pressure comes down. But during the period of time I was taking the amlodipine, my ankles and toes swelled.
Yep.
And that was so it actually increased my shoe size by 1. So it went from 10.5 D to 11.5 D. So that kind of sucked. So as soon as I came off the amlodipine, I was able to wear all my old shoes. So I'm glad I didn't throw them out. So what do you do? What dosage of amlodipine are you taking? Are you
I was on 10, and then I was told to cut it back to 5.
That's the appropriate way to deal with this. Now they'll say, well, we can give you a fluid pill. What I will tell you about the diuretics in this is it doesn't do any good. It's not a matter of fluid retention. It's a matter of capillary permeability. What does it mean? It means you're leaking. So to get the edema down, I'm not mean. No, you're leaking. Oh yeah, you're leaking. You put your ankles up in the air. Okay, so during the day, you're sitting at your desk, put your feet up on something, and then gravity will pull it out of your feet and ankles.
There you go.
So that will work. Now, if they need to further drop back the amlodipine, ask them to consider using clonidine. That's spelled clonidine. Now, clonidine can be done in a pill or it can be done in a patch. The pills are very, very cheap, okay, and they work beautifully. The patches are expensive and they work very, very well. But that's my favorite approach to it because it works darn near every time, and it does it inexpensively. The patches, they're a little pricey. So give that a try. Tell me how it goes. It's not going to matter what you eat or drink. Okay, it's not that you're taking in too much salt. It's simply amlodipine causing leaky capillaries.
Great call. Thanks, Ann. Appreciate
Perfect
that.
call.
407-422-1212. Her line is now open. So, Doc, we've been talking about taking care of yourself and preventative.
Yeah, that's key. That's key to life.
Mm-hmm.
You look around your house. Right now is a great time to do this. Look around your house and look for limbs over your house. Look for things that are hanging over your gutters and downspouts. Because when we get into the next hurricane season, that is where your house is going to get damaged.
Right.
Look for places in your walk where people can trip and fall. Go around your house and look for carpets where you might slip and break your hip. Why? Because it's easier to put tape on a piece of carpet or remove it than replacing your hip. And I'll tell you, it's a whole lot less expensive.
Indeed.
So preventive medicine is no different than just thinking as a disease would think.
Well, guys do it, and gals, don't leave you out, but a lot of them. Car maintenance. You look around, and keep the tires rotating, and things like all that. That you have to make. You're a living being. Your car, you care about it. You change the oil. You change your gaskets and belts.
If you change your oil. Mm-hmm. And you do it every 3,000 miles if it's natural oil and if 6,000 for the synthetics, your engine will last twice as long.
Sure.
Now, if you're only putting 3,000 miles per year on your car, you may not be able to measure the difference, but most people are putting on between 10 and 25,000 miles per year. So that translates into a lot of money.
So
every 5 or 6 years, you take the timing chain out and replace it. Why? Because it's going to cost you $1,500, but replacing your engine costs 6 times that.
Exactly.
Do you change your air filters?
You better, or at least wash
What about
them.
your
Some
cabin?
of them are
What about your cabin filter? There are a lot of these things that have to be done. If you check your alignment, the tires last longer. I drive a truck.
The alignment, but you still want to rotate those tires. You want to do all that basic maintenance. You take care of a car. There's like a book that even goes with it. And you buy a new one, and you check it off, and you do this maintenance on a monthly and this on a quarterly and blah, blah, blah. Why can't you do that with your health, your own body?
Yeah, because they can put a value on the car, but they don't know how to put a value
There is no
on
value.
themselves.
That's the deal.
Right.
I mean, we have our own buddy here, our other doctor, who we have to literally say several times a month, how much is your life worth?
Yes.
Because he's a Scrooge, and he doesn't want to spend a bit of money.
Yeah. Well, yes, I know him very well in that regard. Okay? And that is really a shame because you have to invest in yourself. If you're not willing to invest in yourself, why should anybody else?
Right.
Why is it that some people live healthy into their 90s? I've got patients in their 90s that have normal cholesterols, no statins, normal blood pressure, just they're doing everything they want to do and can do and are having no difficulties. And I've got other patients in their 60s and their limbs are falling off from diabetes. They don't know where they are. And why is that? And if you say genetics, I will tell you that we are 99.99% identical.
No, I'm trying to avoid a bad segue.
Oh,
we got Zach from Orlando on the phone. Speaking of things falling off, Zach wants to know if it's safe to mix Stud Mix and Cialis together.
Yes, it's fine.
There you go, Zach.
Yeah, if I had known about that combination when I was in college or medical school, if they'd had them, I would have gotten them all. Okay, so Stud Mix was my answer to, gee, I'm too cheap to buy Cialis or Levitra or Viagra. And what it does is it lowers estrogen, raises testosterone. It's a gentle vasodilator, okay, for the that area down below that we're not supposed to talk about or at least touch in public. And what does it do? Okay, it makes you more effective, and it's an improvement in performance, and not just in the bedroom, but also elsewhere. Now, the Cialis...
Once a day.
Once a day, you take 3...
5 milligrams.
Well, Cialis, yes. The Stud Mix you take just at bedtime, and you take 3 of them. And the reason for the bedtime isn't because that's when you're going to need it. Okay, you might. It's not because I'll tell you what.
Works best overnight, right?
No, works best overnight. It's not going to guarantee that you get lucky. But what it does do is it blocks the degradation of testosterone to estradiol, which occurs between 3 and 6 in the morning. So it's most effective if you take it at 10, 11 o'clock. All 3 capsules. Cialis, you can take it on a daily basis, and it'll work to keep blood pressure down. It'll work to keep pulmonary hypertension down, and oddly enough, it does beneficial things for you elsewhere. But there's not necessarily any timing attached to it other than the social benefits that you get from it. So if you know that you're going to need it, let's say, 9 o'clock Saturday night, a good time to take it would be 8 o'clock Saturday night, not 8 o'clock Sunday morning.
Oh, yeah.
So it's not dangerous to take them both.
No, not at all. They do 2 different things. The Cialis, Levitra, Viagra, those medications cause changes in a particular enzyme system, okay, called phosphodiesterase. In this case, it's phosphodiesterase 5, and it affects certain parts of the body, not necessarily the other areas, although there may be some bleed over. So Viagra is a funny thing. When you take too much of it, it can actually cause heart issues because it bleeds into the PDE1 receptors. But that's neither here nor there. The Stud. Well, I mean, really. I mean, if you ask a guy whether he'd run the risk of a heart attack just to be able to enjoy himself, they'll run the risk every day of the week. Yeah. Guys are predictable pigs that way, and I know because I am one. But the Stud Mix doesn't do this at all. Purely
doesn't drop blood pressure either.
No, it doesn't.
Nope. So good luck and happy hunting, Zach.
That's one way to look at it. Yes.
Well,
really, stuff
I
works.
have to be careful.
Oh,
I know
it works.
Oh, I know it works. Stud Mix. You can find it at stagesoflifevitamins.com. At stagesoflifevitamins.com, and you too can be like Dr. Dave.
There you go.
That's it, right?
That's the stage.
Okay, Stages of Life Radio is going to continue in just a couple of minutes. We're going to take a quick break. Support our sponsors like the Pharmacy Specialists over in Maitland, a compounding pharmacy that really cares about you.
They're good guys.
And your
gals.
Partner.
Excellent, folks.
Wait, here's the button. There it is. Found it. Everything's hard.
They need to color code those things.
No, it's a dot. You don't even see
I can't see it. Hey, look, I can't see the stuff that's in front of me. You've got these monitors in front of me. I can't read those things.
It's a dot. No, it's fast. Wait. All right, let me go.
I mean, on radio, why do you need a monitor anyway, right? It is interesting. It kind of looks like what you'd expect like a space capsule to look like.
It does.
I agree. These buttons, lights flashing.
The Bucks are up 21-10.
Oh.
What the hell?
They might be winning then.
Well, no, I think it's at the half. Crap. That's right. I love Tom Brady. Don't get me wrong, but I hate the Bucks. I hate that football team. I don't like any Florida NFL team. I don't. I was raised to love the Patriots, but first I was raised to love the Cowboys, and then Pittsburgh, and then the Patriots.
Right. Well, my first wedding, they actually played the Washington Redskins fight song.
Really?
Yeah.
At the first wedding?
The first one. Yeah. Second one, it was an opera.
1 minute. Oh, an opera.
Hey, I'm not your guy, but it was an opera.
I was there. Sarah Grace is a little confused because she said, you had COVID. I thought you said neither you nor anyone in your office caught it, despite seeing so many patients daily and attributed to your immunity to taking colostrum.
Well, here's what happened, okay? I will clue you into this one.
45 seconds.
And this is what happens
45 nutshell
when you
seconds.
brag, okay? So one of my secretaries got it from her kids. Okay, now over the Christmas break, we were closed. So where and when did I get it? I got it at a restaurant on January 1st. And my wife and I went and ate at the same place, didn't follow my own instructions, and we both got sick simultaneously. And you know something? That sucks. So shame on me for bragging.
Don't be like Dr. Dave.
Not in that regard.
Not like that.
Now, so yes, I've heard many, and I told you so.
I don't think I did that math properly. Oh well. Here we go. Welcome back to Stages of Life Radio on News Radio WFLA Orlando.
Taking up the downbeat.
I know. You got to do it, man. Yeah, we're in here popping away. Dr. David Klein and me, Melissa Fox from Good Morning Orlando and various other radio attributes about the country. Anyway, so this is the last leg of the tour, my friend.
No kidding.
Yeah.
Oh, my, how time flies.
407-422-1212. Text line 23680. And we are on social media at Stages of Life Medical Institute, as well as on my personal page and also on the WFLA Orlando page.
And like us on Facebook, would you? I'm not sure why.
Like.
They tell me I'm supposed to ask you that. But
Well,
you know.
that way we can see your comments and
there we
stuff,
go.
too. If you don't like us, sometimes we don't get to see the comments. It's kind of a weird
It's
thing.
weird.
It really is.
Yeah. So put that little thumb up, which, by the way, is a curse in the Middle East. You know that, don't you?
Yes.
Yeah.
Just like the peace sign means something totally different in other countries.
You have got to be careful. We learned this in the military.
Yeah, I did too.
Yeah. Hey, you're doing great. Big thumbs up, and then they get shot. You know? It's bad.
Bad idea. It's good for you. No. Down, up.
No.
All right. So anyway, as I said, the phone line is open, 407-422-1212. And Doc has been talking about prevention, getting off the stick and doing what you're supposed to do, and that's getting your checkups, doing your prescription updates, even if you have to do a telehealth visit.
Which is fine. Even, I am not a big fan of telehealth.
Nobody is, but it does get some of the job done.
It gets some of it done. There's no question about it. As the preventive medicine thing goes, okay, most of the problems that we get into, people say, well, I've got pre-existing illnesses with COVID. We have got the sickest society out there. Do you ever wonder about why 2/3 of the people are fat? Okay, fat. I'm sorry, and then a significant portion of them are morbidly obese. It's because of our diet. It's what we're eating, and most importantly, it's what we're not eating properly. These are major issues. So with regards to procrastination, the first thing you need to do is to sit down with somebody that knows what the heck they're doing to help you plan out what you can do to prevent things like cancer, diabetes, to help you with your obesity if it's an issue, and to deal with preventing other illnesses like Alzheimer's. And if you don't think you can do it, you are dead wrong. So it's like melanoma. Ask your family doctor. Just say, Dr. Jones, what can I take to prevent melanoma or reduce my risk of it? And they're going to go, I don't know. I don't think there's anything. And what I'm going to suggest that you do is your own reading. Let's not confuse research with reading. All right, let's just not do that right now, okay? Because that's another show. But go on the National Library of Medicine PubMed. That's PUBMED.gov. Costs you nothing to do this but some time and a little bit of practice so you can figure out how to do real research the way Dr. Dave does. And you go ahead and you do a Boolean search, which is a little more than putting a 2-word search in so that you see both words in the article, and you put in metformin, a space, a plus sign, and melanoma. And 23 articles will pop up on preventing melanoma with metformin. And they give away metformin at Publix, which is a marvelous, absolutely marvelous grocery chain here in Florida. If you have it in your state, God bless you. It's great. If you don't, it's too bad. But they give it away here. All right, metformin reduces your risk of all cancer. So if you go on PubMed.gov and look up metformin, put a space plus cancer prevention, you'll see over 1,300 articles all about preventing lots of different types of cancers. And it's up to you to read these. And the reason for this is simple. Nobody pays anybody or takes them out to lunch or dinner to teach them about metformin.
Oh.
That's really what it's all about, because there's no financial incentive for anybody to teach the docs. So the docs need to know.
Dirt cheap.
They need to know where to look for it. Okay, so it's up to you to make these decisions. Do the same search, the same one for vitamin D and cancer prevention. Thousands of articles come up. So I don't know if you've noticed or not, but the doctors are actually, for the most part, starting to test people for levels. Now, if this has been known for 35 years, but it's really only been popular over the past 2 or 3, that's kind of sad now, don't you think?
A little bit.
But there are lots of these. And so there are many different nutraceuticals, there are many different types of approaches that you can to reduce your risk of blank, whatever it happens to be. Whether it's thyroid disease, whether it's obesity, whether it is diabetes and this or diabetes and that.
Metformin, berberine, same stuff?
No, it's not the same thing. Metformin comes from the French lilac. Okay, not that makes any difference, but it's been around since the 1920s. Okay. Extraordinarily safe. What they say, well, you need to adjust the dosage if somebody's in kidney failure. Well, let me give you a little clue. All right, I have seen kidney failure improve with the use of metformin.
I've seen it.
It is interesting. Why? Because elevations of insulin and blood sugar kill the kidneys. And if you start bringing the insulin and blood sugar down, wouldn't you know it, the kidney starts to bounce back. So it takes some experience. That's all. You need to go to somebody who knows what the heck they're doing with this. You know, if you have a sore throat, okay, well, you need an antibiotic. Do you really? Okay, why?
No.
Why do I need an antibiotic?
Because I want to bring my immune system down so I can get other stuff.
It will trash your immune system, and it'll trash the beneficial flora in your gut. It takes a year to bounce back from it.
Yeesh.
So antibiotics should be used if you know you have a bacterial infection. So if you have a bacterial urinary tract infection, you do it. Let's see what we have on the line here.
It's Donald. Donald from Winter Park. What's going on? What's your question? Donald.
There we go.
Yes.
He's there. Yeah, we only have about 1:50. So what you got?
Okay, well, I have AFib.
All right.
That I do not know I have.
Okay. All right. So you have atrial fib, but you can't feel it. All right.
And what are you taking?
What?
You're taking Prodoxa?
Yes.
Okay.
And I take it twice a day.
All right.
And I've been doing it since 2009.
That's okay. Good.
I'm just wondering if, I'm sorry?
That's good. Go on.
I was just wondering if this is a good thing to continue doing, because my brother was just diagnosed with ablation, with the AFib, and he's had an ablation.
Okay.
And trying to recover from it. I was never asked to have an ablation.
Well, when I was at
I was
Duke,
told I didn't need it.
When I was at Duke years ago, we used to do the ablations by doing open heart. Okay, that was where the technique was actually worked out. Now it's actually done through a catheter. It's a whole lot easier now than it used to be. So every decade that goes by, things get a little bit better or a lot better. So you were diagnosed in 2009, but they got things under control with the Prodaxa. Between you and me, I would rather not have the surgical procedure if I could get it done or controlled chemically. So my first approach when people walk through the door, and we do EKGs on everybody over the age of 60, unless they find excuses for us not to do it. And they do this all the time. I don't want to do it today. I don't want to do it. I don't want to do it. They come through, they have AFib. I start them on something called coenzyme Q10. The dosage is 300 milligrams once a day. And I'm going to suggest that you do that anyway. Because just because you have AFib and Prodaxa doesn't mean that it couldn't have been triggered with CoQ or by CoQ10 deficiency. So what do cardiologists all have in common? Okay? And then that is the unflappable desire to put you on a statin.
Thanks, Donald.
They all do it. Okay, and what's the number one side effect of statin use? CoQ10 deficiency. And what does CoQ10 deficiency cause? Atrial fibrillation.
Get out.
Yeah, imagine that. So that would be the reation I would do it.
It's almost time to give some parting messages, Dr. Klein.
Yes, ma'am. Okay, so here's the deal. If you guys would like to become part of the Stages of Life family, we're taking patients. I've been in this practice 42 years. We have never turned away somebody who wanted to come in because our practice is full. You can call us at 407-679-3337. That's 407-679-3337, and ask for Iris. You can see us on stagesoflifevitamins.com, suffernomore.com, and again, 407-679-3337. Please make the call.
Be well. I'll see y'all tomorrow morning, and he'll be back next week at 4.
You've been listening to Stages of Life Radio with Dr. David Klein. Check out stagesoflifemedicalinstitute.com or stop by 1917 Booth Circle in Longwood.